Marissa Town, the Clinical Director for Children with Diabetes. Welcome to the weekly with Children with Diabetes, stuff you should care about. On this series, we're going to talk about current topics that are important for us people living with diabetes. So first, I'd like to talk about an article out of Spain in which they discussed the effects of the COVID-19 lockdown on patients with diabetes. So in this study, they looked at 307 people with Libre Flash continuous glucose monitoring systems so that they could look at the continuous glucose monitor data. These were all people who were wearing it more than 70% of the time. It was a pretty good split between gender. Average age was, or median age was 45 years. And 93% were on multiple daily injections, while only 7% were on insulin pumps. And it was hypothesized that it was going to get worse for people with diabetes to be on lockdown because of lack of ability to exercise outside and things like that. However, very coolly, things actually got better. And I want to show you a graph. So on this graph, you can see not only did people with A1Cs that were normally at target, which is less than 7, but people with A1Cs of between 7 and 8, and especially people with A1Cs greater than 8, had a larger change in time and range. So the green area that you see here is the time and range from 70 to 180 milligrams per deciliter. And really, this is what most people are looking at because it's more indicative of how your blood sugars are staying within that target as opposed to just an average, because you can have a pretty decent looking average and still have quite a lot of variability. So just wanted to give you some bright news on the side of positive impacts of COVID-19 related to diabetes. Stay healthy, keep washing your hands, and we'll see you next week.